If you've been diagnosed with knee osteoarthritis and you're struggling with pain, stiffness, or just feeling limited by your weight, this video is for you. Today we're diving into a powerful and growing rehab technique called blood flow restriction training, or BFR for short, and how it can help people with obesity-related knee osteoarthritis get stronger, move better, and reduce pain without putting extra strain on the joints. In this video, we'll cover what BFR training actually is and how it works, why it's especially helpful for people who can't tolerate heavy exercise, what the science says about BFR for knee osteoarthritis, and more. By the end, you'll have a solid understanding of whether BFR might be right for you or someone you care about, and what to discuss with your physiotherapist or healthcare provider. So let's get into it. But first, as always, please take note of our disclaimer. BFR training involves performing low-load resistance exercises while partially restricting blood flow to the working muscles using cuffs or elastic wraps. This creates a low oxygen environment that triggers muscle growth and strength gains, even with light weights or body weight movements. Originally developed in Japan in the 1960s as Katsu training, BFR has since gained global attention and is now used in rehab, sports medicine, and joint care, particularly for people with knee osteoarthritis who can't tolerate heavy lifting, including those who are overweight or obese. By restricting venous return and limiting arterial flow, BFR recreates metabolic stress, increases fast twitch muscle activation, and boosts anabolic hormones, leading to muscle gains with less strain on the joints. Over time, because knee OA can make everyday movements painful and difficult, it often leads to muscle weakness around the joint, especially in the quadriceps. Strengthening these muscles is key to managing OA, but traditional resistance training can be too demanding for those with joint pain, particularly individuals who are overweight or obese, where excess weight adds even more pressure on the knees. BFR training offers a promising alternative. By partially restricting blood flow during low-load exercise, BFR stimulates the effects of high-intensity training, allowing users to build strength with lighter weights and far less joint stress. This makes it especially helpful for those who can't tolerate heavy lifting, but still need to improve function and mobility. For people who are overweight or obese, BFR can help break the cycle of inactivity and joint decline by offering a more comfortable entry point into strength training. As confidence and strength improve, so does adherence to rehab and movement goals. But what exactly does the research show behind this? But just on a quick side note, if you'd like to undertake our evidence-based and results-backed personalized Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Research shows that BFR training, when combined with low-load resistance exercise, can effectively improve muscle strength, joint function, and proprioception in individuals with knee OA, often matching the results of traditional high-load resistance training. This makes BFR a promising option for people who cannot tolerate heavy joint loading due to pain, obesity, or limited mobility. Nevertheless, as with any intervention, appropriate candidate selection is critical to ensure safety and effectiveness. BFR training is especially suitable for these populations. For them, BFR allows for meaningful improvements in muscle strength and function using light weights or even body weight movements, reducing the risk of pain or joint overload during exercise. Despite its benefits, BFR is not appropriate for everyone, and caution is needed in individuals with certain medical conditions. BFR should not be used for these populations. These conditions present a higher risk for complications such as blood clots, poor wound healing, or adverse vascular responses, and BFR should be avoided unless cleared by a qualified healthcare provider who can assess the individual's risk profile and monitor its application under controlled conditions. And then we come to our target population: individuals who are overweight or obese and living with knee OA. This group stands to benefit greatly from BFR training due to its ability to stimulate strength gains without overloading the joints, as we mentioned. However, they are also more likely to have underlying health conditions that require additional screening and medical oversight before BFR can be considered safe. Common comorbidities in this population include these. These conditions can increase the risk of adverse effects during BFR, such as circulatory compromise, nerve compression, bruising, or elevated cardiovascular stress. For this reason, medical clearance from a GP or referring clinician is essential before enabling BFR in this population. So after reviewing the research as well as the indications, contraindications and precautions, it's clear that BFR training can be a tool of good potential when used with the right people in the right way. For individuals with knee OA who are overweight or obese, BFR offers a low-impact method to improve muscle strength and joint function, especially when high-load training is not tolerated. In properly selected individuals, it may enhance outcomes and support greater engagement with movement and rehabilitation. That said, like any intervention, BFR is not without its risks, even when used appropriately. In most cases, participants may experience mild, expected side effects, particularly in the early stages of training. These are not only common, but are part of the physiological response that makes BFR effective. However, for a small number of individuals, especially those with underlying conditions not yet identified, more serious side effects may occur. This reinforces the importance of comprehensive screening and ensuring BFR is only introduced in individuals who are medically cleared and clinically appropriate. Have you tried blood flow restriction training for knee osteoarthritis regardless of your weight status? What was your experience? We'd love to hear from you in the comment section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So, that has been our video. Thanks for watching, and I'll see you next time.